During a vaginal childbirth, the first stage of labor lasts about 12 to 19 hours and starts when your baby settles lower into your pelvis. In response, your cervix begins to efface or become thinner and dilate or widen. During this time, you may feel strong, regular contractions occurring every 5 to 20 minutes and lower back pain and cramping that doesn't go away. You may see a brownish or reddish mucus discharge, which could be the mucus plug at the opening of your cervix, falling out. Your water may break, which can either be a large gush of fluid or a continuous trickle. If you experience any of these symptoms, contact your doctor or midwife to see if you should go to the hospital. At the beginning of stage 2 of labor, which usually lasts from 20 minutes to 2 hours, your cervix is fully dilated to 10 centimeters. And your baby's head has moved beyond the cervical opening into your birth canal. Your doctor or midwife will instruct you to push during your contractions and rest between them. In a normal delivery, your baby's head will rotate to face your back. During active labor, your uterus is divided into an active segment that contracts, pushing the baby downward, and a flexible passive segment that remains relaxed, stretching to provide more room for the baby to pass through. When the top of your baby's head appears, or crowns, your doctor may make a small cut, called an episiotomy, to enlarge the vaginal opening. Then, your doctor or midwife will give you instructions on how to push your baby out. As your baby's head passes through the birth canal, it molds into an elongated shape. An elongated head shape will resolve itself within a few days as the skull bones shift back into place. After your baby's head exits the birth canal, his or her head and shoulders will rotate to help the shoulders pass through the birth canal. Your baby's shoulders are delivered one after the other in order to fit through your pelvis.
Often referred to as a C-section, is a surgical procedure in which incisions are made in a woman's abdomen and uterus to deliver a baby. Some cesarean sections are planned. More often, however, the need for the procedure becomes apparent after the onset of labor when abnormal conditions make a vaginal delivery unsafe for the mother or her baby. Common indications for cesarean section include dystocia, placenta previa, and fetal distress. Dystocia, or prolonged non-progressive labor, can occur when the baby's head is unable to fit through the birth canal or its body is in an unfavorable position, such as perpendicular to the birth canal or buttocks first, which is the breech position. Placenta previa occurs when a low-lying placenta partially or completely blocks the cervical opening. Fetal distress occurs whenever the health of the baby is in imminent danger, usually from inadequate blood flow through the placenta or umbilical cord. Fetal distress can occur when the placenta separates from the wall of the uterus prior to delivery or the umbilical cord becomes compressed or squeezed. Other conditions that may require a cesarean section include multiple births, large tumors of the uterus, genital herpes or other infections, or medical problems such as uncontrolled diabetes or hypertension. Your doctor may use ultrasound testing and a fetal heart monitor to help decide whether your baby should be delivered by cesarean. When a cesarean section becomes necessary, you will be prepped for surgery. If not already in place, an intravenous line will be started, and a catheter will be inserted into your bladder to drain urine. In the operating room, you will be given anesthesia. In most cases, a spinal anesthetic is administered to numb the lower portion of your body. Sometimes, however, a general anesthetic will be used. Your doctor will begin by making an incision in your abdomen. It will either be a vertical incision from just below the navel to the top of the pubic bone, or more frequently, a horizontal incision across and just above, or more frequently, a horizontal incision across and just above the pubic bone. This is often called a bikini cut. Your doctor will then make a second incision on the lower part of the uterus. Once the uterus is opened, your doctor will rupture the amniotic sac if it is still intact and deliver the baby. The time from the initial abdominal incision to birth is typically 5 minutes. Your doctor will then clamp and cut the umbilical cord. Gently remove the placenta and tightly suture your uterus and abdomen. This typically takes about 45 minutes. The hospital stay after a cesarean section is usually 3 to 5 days. During this time, you will be encouraged to breastfeed, nap when the baby sleeps, and get out of bed often. While most patients are able to take care of their new baby soon after the procedure, full recovery may take 6 to 8 weeks. Your scar will lighten as it heals.